Hello, I'm Amy. I'm a community speech and language therapist in the Lewisham and Greenwich Trust. I've been with the Trust for many years now. I started my time here as a student, progressed to a therapy assistant and finally as a specialist therapist in the community. In community we work in a really range of settings, so that could be anything from a patient's home to a nursing home, a shop or even a cafe. You can really tailor your therapy to the needs of the individual, which means you can get really creative, and that's something that's really exciting. With it being that close to the city, there's also great opportunities outside of work, so it's really easy to get into town to meet friends after work. And in Lewisham itself there's loads of really lovely bars and restaurants, so it's a really great place to be and I've really enjoyed working here.
I started my new post here at the Queen Elizabeth Hospital as a Band 4, but I've been here for quite a few years working as a Band 3 assistant. So I was quite lucky that over the years I've developed loads of knowledge and skills and been able to use those to progress further in my career, and unfortunately enough be able to stay here at the hospital amongst all of my colleagues and the great team that we work in here in the hospital.
Coming in to work with the Trust was really good because I did my second year placement with the Trust as well. So it's nice to sort of see the progression that I've had from being a student to now being a practitioner. And for me, one of the reasons why I applied to come back to work for the Trust from being a student was, number one, I really enjoyed my time whilst as a student, and it just felt natural just to come back, and it was a local hospital for me as well, so I felt like giving something back to the community, working for my local trust.
Hi, my name's Rosalind and I'm the physio inpatient lead at the Queen Elizabeth Hospital. One of the really good things about working at Lewisham and Greenwich Trust is all the new projects and ideas we have going on. At the moment we're using red Zimmer frames on the wards to help with patients who've got dementia, to try and make sure that they see the walking aid they need to use and reduce any falls that are happening. This is something we're hoping to expand and we're getting a lot of staff involved in. Another initiative we've got going on at the moment is the development of advanced clinical practitioner roles. This is something that some of our physios are doing at Lewisham site and at Queen Elizabeth, so helping with their development into an advanced clinical practitioner to support with some of the Trust priority pathways. This is something, with the success of this, we're hoping to expand, and there'll be a lot more opportunities for staff to progress to this role.
My name is Frah. I am one of the speech therapists here at Queen Elizabeth Hospital. We are currently in our video fluoroscopy clinic, which we as a speech therapy team run weekly. It's where we complete a moving x-ray of a patient's swallowing to further inform our management and find out what's going to help them to eat and drink safer and make it easier for them to eat and drink. I initially started helping the speech therapy team facilitate the video fluoroscopy clinic when I was here on a student placement, which is a great opportunity because it's not one that each therapy service is able to directly run. And I then continued doing it as a volunteer, and now I'm able to do it while I'm here on a permanent post as a Band 5 speech therapist.
My name is Sally. I've worked for Lewisham and Greenwich NHS Trust as a physiotherapist for about a year now. The main thing that attracted me to this trust initially when applying for jobs to start off my career was the fantastic range of rotations that they offered. These range from inpatient medical, surgical, intensive care, through to stroke, neurological outliers, MSK outpatients, women's health, hydrotherapy, and all the way out to community, offering care and therapy in people's homes and also in bed-based rehab as well. Currently I work on a medical ward, which is haematology and oncology, so there have definitely been challenges to the job, but I felt really well supported by my whole team.
My name is Loide Silva. I'm a therapist here in Lewisham and Greenwich NHS Trust. In terms of the different rotations that we provide within the trust in therapeutic setting, we have from pediatrics to ITU, intensive care, we have oncology and also medical rehab, and that gives us an experience to rotate and work within different areas and to improve our skills in the different domains. Also, for instance, we work in wards like this one, that is a discharge ward, where we work closely with social services, the different therapeutic teams like occupational therapists, the doctors and the nurses, where we provide the best pathway for their discharge home.